to keep being flexible and keep being nimble and keep being innovative. But that's what our kids need this summer, right? They need opportunities to connect with their peers. They need opportunities to connect with adults like yourselves and your staff, and to just engage and have fun and be outdoors and experience learning that's not behind a screen. And so a big key piece of that is obviously everyone's health and safety. And that's why I'm so pleased to have Brina with us again today, who's going to walk us through the new health guidance for summer and childcare programs, and to answer some of our questions that you all submitted as part of the registration. And so Brina, I'm going to go ahead and turn things over to you, and thank you for being with us again.
Thank you, Nicole. Hi, everyone. Thanks for taking time. We're going to go through the changes in the guidance, and then, as Nicole said, your questions are where all the richness of the conversation lies. It's very easy to create guidance in a group, and then it's putting it out to the people actually working with children is where we see where it needs clarity and doesn't make sense. I do want to start with gratitude. Many of you know the practice of beginning or ending a day with gratitude has been shown to change your biochemistry, your neurobiology. And in that spirit, I wanted to start with, I am grateful for the scientists who developed so quickly, like really unparalleled scientific collaboration that led to these vaccines. I also have extreme gratitude for you all. I've felt this connections from the very beginning that you showed a lot of courage and put aside some of the uncertainty early on. We are in a much better place now, and I hope you come away today feeling that energy. And then my last just fun gratitude is the best speech I ever heard at a wedding was a little boy got up and said, "Here's to cinnamon toast." And I just have to agree, I just love and I'm grateful for cinnamon toast. Okay, let's advance here. So, Vermont Forward. This is the guiding principle of the next 3 or 4 months of our life as we head into a summer that will no longer have government restrictions as it relates to our behavior. Interesting. And what I want to acknowledge for all of us, because you're such a good thinkers and you understand child development, youth development, this is not an easy pathway for our cortex as people who have been so regulated and have so many mandates around us and have had so many rules. We're now having to untangle and uncouple all of our thought patterns as it relates to COVID. So please know it's April 29th, and we can be with each other together all the way until July and beyond as we wonder together about how this feels and share with each other what recovery looks like, and really, even more importantly, how it feels. So I don't want to spend a ton of time on this, but I wanted you to see that this is 100% based on the percent of eligible Vermonters who have received at least one dose of the vaccine. And the May 1st metric, we met a few days ago, which is we now have 60% of people who are eligible have received one dose. So that puts us squarely into step 2, which we're going to start on Saturday. And that is really when we're going to start gathering. And vaccinated people can gather in large groups outside. And if you want to gather unvaccinated, there's just some consideration about how many people and what the size of your space is. But this really doesn't relate to you because we've always had this plan is leading toward a summer where you will not have to be counting heads or measuring out the square footage of your space. But I wanted you to see where we're headed. So for now, masks and distancing are still part of our conversation, but the ultimate path here is when we get to that 70 to 85% of eligible Vermonters vaccinated, there will no longer be any mandates about masks or distance. So sit with that for a minute. I'm going to state it a few other ways in some subsequent slides. There's July 4th. I will note the team at the governor's office asks us a lot to please don't say the date as if a hard stop. It's really about the percent of eligible Vermonters vaccinated. So all of these dates are subject to change. So we just know we've met that first mark of May 1st. So a couple of contextual things that come up in the last, the guidance was, was released Friday, today's Thursday. The Supervisory Union and Independent School Guidance preceded this, and it's in force until the end of the school year. It's actually got more restrictions because we made it, in March, and we didn't follow Vermont Forward, so everybody's masked until the end of the year. The distancing is still important. So please know that, and if you have some space that's confused by that, I'm happy to answer questions. If something changes, we would always go back and update it, but recognizing schools are going to depart June 18th, they have their own guidance. There's also a very complex space that we don't want to spend a ton of time on today about, can you make up your own rules? I just want to acknowledge that if you receive public dollars, that Vermont Forward pathway leading toward no mandate for mask or distance is the what you have to follow. But especially in our childcare space, there've been a lot of conversations. If I'm a private provider, if I have a home-based childcare and I want to put in some other guidance, they are allowed to do that. I'm super concerned about that, and I want to spend some time in a really authentic space with you about that. That to me will set up some access and equity challenges, and I would be very interested to know why a program would feel it could predict more about public health than the experts that have guided the Vermont Forward plan. So I would really want a dialogue. I'd want you to call me and say, I don't think it's true that we can X, Y, or Z. So let's talk about that together today. So here are the things that I want to address quickly. There's about 9 things that are a little different. Health screenings, travel, what to do if you've already had the vaccine, a little bit about transportation. We'll talk about the drop-off pickup routines, hand hygiene, masks, cleaning, physical distancing, and a little bit about volunteers and visitors. So health screenings have been handed back to individuals and families. But please know, if anything comes out of this pandemic, people should be staying home when they're sick. And it was sad and important to note how often we have allowed sick children and sick staff to work with each other pre-COVID. And I think Vermont After School would join me in our work to get better social policies to make sure people have the paid leave they need to care for their children when they don't feel well. So everyone should still stay home, but that idea that you check in on a kid at the onset of your day is now going to be with families. No attestation. We're not asking for pieces of paper. We're back to just common sense. Assess your child in the morning, and please don't send her when she's not well. No temperature checks. But if someone comes to you and is in front of you, you have every authority from my perspective and every right to say, you do not look like you feel well, and let's work that through. That's true of staff as well. So a big shift here. So let's note that. I just put in one bullet about after you've had a vaccine. So it's pretty confusing after you've had a vaccine because for a day or two you feel crummy. By the way, a great sign that your immune system is working. So don't be alarmed if you feel a little achy. Is that COVID or is it the vaccine? That's not for a program to sort out. You don't have to figure out if somebody is having a reaction to the vaccine or a response, I should say, versus symptoms of illness that should stay home. So that's a healthcare provider thing. So people that don't feel well after a vaccine should stay home. This travel stuff hit hard on April 9th. The first step of the governor's Vermont Forward plan is no quarantining after travel domestically, 0. Nobody has to come home from a trip and stay put. But they also said we want all those people required to be tested. Here's the trick though. There's no enforcement. We would never ask you to ask a child for evidence he had a test. So this falls squarely into honor system, self-attestation. Come on, Vermont, do the right thing. But you no longer have to have any brain energy spent on whether a person in your program, either a staff or a child or a youth, has traveled. Now, international travel is totally different, and it really depends on where you've been. And I'll tell you the talking point about this later, but I'm going to say it now. travel itself is not a high-risk activity anymore. We all got very acclimated to that map that Vermont was green and everything else was red, and we were so frightened about people traveling. But when we've analyzed the last year, it's only 5% of any case we've had is associated with travel. And honestly, Vermont, a couple of weeks ago, we had way more cases than our surrounding states. So buses, private cars, vans, go for it. Put everybody in, do the best you can, okay? Now, start by spacing out if you can. Please don't have anyone sick on the bus. Normal cleaning, just whatever you would do. Nothing like before where we wiped every surface every hour. And as long as there's still masks in Vermont Forward, there are masks on these buses, vans, and private car. Our environmental health guys are really helpful, and they still want people to think about air exchange. So please open windows, maybe leave the seat behind the bus driver open. This all falls into do the best you can, but with a little bit of thought toward the air exchange. So again, major shift, and probably will require a little bit of practice on our part. So we spent a lot of time in the last year thinking about a structured arrival and departure so that you could not have congregating families waiting for that health screening. Well, the health screening is going away, and we'd like you to consider that you don't need this. Families have expressed a lot of challenges with a staggered drop-off, especially in childcare, being handed a slot. You can only come at 8:50, you know, with their work schedules and the way that worked. So we want to make sure people don't hold this up anymore as an essential public health strategy. If it helps you manage how you want to check in with students or youth and children, or, you know, you're welcome to do some sort of structure, but in terms of the public health reasons for it, they're no longer on the table. But please don't drop your child off if you're ill, or if you've been told to quarantine because you're close contact with someone with COVID, or you yourself have COVID. Common sense, but important to state. Okay, hand hygiene, mask cleaning. Hand hygiene is just basic infection control. You guys were absolute heroes and troopers last summer with the amount you had to pay attention to surfaces, and especially outdoor surfaces, and all the shared materials and all of the, you know, the learning we've done about this virus. So this was one of the biggest misnomers about COVID in the beginning. We believed, we meaning people way smarter than me, were concerned this was spread from surfaces, and the virus is not. I'll show you a slide about that in a sec. Also, this mask thing got us a little off track last week, because you may recall, those of you that work with younger children, we never mandated masks for kids under 5. We asked that it was strongly recommended, and we did very well with that as a state. Kids tried, and most kids pulled it off. So the governor saying masks until July doesn't mean now you got to go back to 3-year-olds who haven't been masked and try to get a mask on them. You would not believe how many questions we got about that. So the masks follow Vermont Forward, but children under 5 still have their strong recommendation. They're not required. And then once we get to that metric of step 3, encouraged. Personal choice. Very interesting. And then cleaning and disinfecting. So much less attention to surfaces. The CDC research shows surface transmission is not the main route of the virus spreading. The principal mode is respiratory, and so regular cleaning, soap and water, no more disinfecting. Distancing, we're going to follow that. We're going to try to keep kids 3 feet apart and adults 6 feet from them until step 3. And when we hit that metric that everybody, you know, the high percentages of people eligible are vaccinated, there will be almost no attention to who's next to whom. But we as pediatricians and the people in my school and childcare branch couldn't help ourselves, and we put some best practice over here. We still want everybody outside when possible. We don't want unvaccinated children to be in large groups for long periods of time if possible, but all just do the best you can. We want you to think more carefully about eating, which is just obviously there's some risk to eating if you're happen to have the virus. And then continuing to think about singing as a high-risk activity. If you want more information about singing and music, there is specific music guidance in the school guidance. And then we got to this place after much ado. The school guidance says volunteers are allowed and visitors are not, just until the third week of June. And the reason is schools felt a lot of loss around the absence of volunteers. Volunteers played a really important role in the enrichment activities in their schools. So we went with self-attestation honor system. If a volunteer says I was vaccinated, they are now welcome in our schools. They're also welcome if they say I had within the last 90 days had COVID, but there's no paperwork. There's no what they call a vaccine immunity passport. It's just stop at the front desk. I'm a volunteer, put your name tag on and go work with young people. So we're going to do that same thing with you all. What we said about visitors was, and this was a lot for our childcare colleagues, we're going to sort of hang back and not do the visitors in the next few months. But again, with people getting vaccinated, they're going to be allowed after that. And as you know, teachers and student teachers, interns, learners have always been allowed, and that continues, as well as field trips. I bet you have a lot of questions about field trips, so just look at the transportation, and you're welcome to go anywhere you want on a field trip as long as you follow the guidance. I put in one slide about overnight camp because that's a separate guidance document. As you may know, that's mostly led by the Agency of Commerce and Community Development. It's a really short document. So we were proud to get our childcare and out of school time down to, 10 pages. This is 2. And the reason is they just set it up that kids should try to minimize exposure before arrival, but certainly not quarantine, just what they call low-risk activities. Kids that arrive for overnight camp need a test within 72 hours prior to arrival. The mask is going to follow the Vermont Forward. And then there's just a few sentences on some of the special considerations. And we're very aware that there will be cases. I should have said that at the beginning. COVID is becoming endemic, which means it's going to be a part of our viral tapestry, just like rhinovirus and influenza and all the viruses we are more familiar with or were more familiar with. So it isn't that there won't be cases in your programs either, and we still will have a contact tracing system, and we still will really manage the advice to a program who should quarantine based on consideration of close contact. So let me do these sort of 4 or 5 bullets, head into some questions. Vermonters do not need to quarantine after travel because our case counts are down. Travel is not a high-risk activity, and only 5% of our cases to date have even been associated with travel. Each step in Vermont Forward is based on increasing percentages of people getting the vaccine, which is definitely already leading to fewer cases. By summer, masks will be personal choice and distancing. It's not that it won't be a reasonable thing to do, it's that it's no longer a government mandate. So again, lots of work to do for me personally, cognitively here, right? Maybe you as well. We remove the health screenings from the responsibility of childcare or school or summer program because the need to do this should go back to individuals. This is the general infectious disease principle that sick people should stay home. And again, the fever is a low percentage symptom. The last I looked, 17% of children with pediatric COVID in Vermont had a fever. So that it's not really the most important symptom or even a important symptom. And then here's some confusion. Friday, we released Vermont's out of school time and childcare guidance. And then Sunday, the CDC said, here's the summer camp guidance. They're close enough, but the CDC has to address the US as a whole. So they still talk about distancing. They still talk about masking. Vermont is sticking with its guidance because our cases are low and our vaccine rates are high. Look at that, I stated it twice because it's so important. And then the last thing that's confusing is 2 days ago, the CDC said, if you're vaccinated, you can be unmasked with groups, small groups of people outside. Vermont's going to stick with the Vermont Forward plan, which is vaccinated people can get together, maybe in their own privacy, be unmasked. But if you're out and about with some people, you still need a mask in Vermont until we get to the metric of step 3. So we're off with the CDC on a few things. And I think you, working with young people, probably can roll with this. A lot of people are struggling with this, but this is this muddy pond that we've been in together for a long time. Okay, I'm moving to your questions. I want to ask Nicole if we're still rolling along. You can hear me. Anything urgent in the chat?
There are a few in the chat. If you want to maybe start with a couple of those. Is that okay?
Sure. Yeah, let's see if I have the capability to do chat and screen share. How's that?
I can read to you, Brina, if you want.
I think it might be easy. Well, you tell me.
Okay.
You want to just do them in order?
Yeah. So Carrie asked a great one about, will the dates move up? Do we expect the dates to move up if vaccine rates go faster than what we currently think?
It's a great question. So not this week. So that came up. Why couldn't we start step 2 Tuesday? Because we hit the metric on Tuesday. So far the answer is no. We're sticking with the first of each month. But I've learned that decisions, you know, I used to say to you guys in the beginning of webinars, these are complex times. I may say something today that needs correction tomorrow. So I'll say that again to this gang.
Great. Let's see. Here's another great one. Are parents allowed in the building? And also there was a question a little bit later about the definition of a visitor. Are parents considered visitors? What about?
Yeah, they still are. That's exactly why we struggle with this. We have a child care advisory group, and we spent quite a lot of time talking about visitors. Parents are visitors, yes. And so for the next few months, we're going to stick with the no parents in the buildings, and then relax that when we get to the step 3. And it's really based on, and this is that strength-based, wonderful world we all want to live in, that I firmly live in. I trust people, but it's a tricky space for some to enter about a person's vaccine status being honor system. And, you know, I can't imagine a world where a person would pretend they were vaccinated and enter a building. But there's enough sort of shifts that we need to make together that a couple of months of still prioritizing volunteers but not visitors. The implication of the definition, and maybe you would disagree, is a volunteer has a role, and that's been determined to be that the schools or your program is going to use, as opposed to a visitor, which is just a visit, a stopover.
That makes great sense. Rena, when you were talking about the school guidance going through the end of the school year, last summer we got into a little bit of a tricky spot with programs that are operated in schools or by schools, trying to follow both sets of guidance. Is there a hard and fast stop date for the school guidance, and do we anticipate something coming out that would change that?
Yeah, it's a great question. No, you should follow this guidance. You're an out of school time program. I mean, if you're working in a school at 3 o'clock, you follow the school guidance until school's out for summer. So that's the hard stop. So you're not going to get any more guidance. You're either in school as it relates to, you know, the school rules, I guess, and then when school is out, you're part of the out of school time. I mean, I guess as I'm saying that, I'm realizing there's probably some very specific examples where that's not true, where you should be following this now because you're the care of children outside of the public school system because you're a different, you're employed by someone else. I would encourage folks that are in that space to reach out to our school and childcare branch so we can help you, because there really isn't any difference right now because of the masking is all. The only thing that's going to be different is after school's out, we're heading toward no mask mandate and no distancing mandate. So let's think about that together a little bit. I'll table that one for complexity.
Okay. And that's a great question, because here's one about masking. So after July 4th, it's personal choice to wear a mask or not. Does that mean that programs can't have a policy of requiring masks after that point?
Yeah, so that gets to that talking point. I would really encourage you not to have your own policy, but I'm not in any position as Brina to tell you if you're a private program, you can't set up all your own rules. But I would really want to talk to you about why. Does it mean you don't believe that we're at herd immunity? Are you not feeling safe? That needs dialogue, because the whole state is moving to a direction. So I anticipate this question. We've had it a lot even this week. I just feel like we want to be careful not to create access challenges where some programs are setting things up differently, and that there's a equity principle at play here, that some aren't having access. So let's figure out why you would want a stricter policy, and then talk together about the public health behind that.
Great. So I know there are a bunch of questions in here about transportation. I'm wondering if we go to the questions that we shared with you ahead of time, Brina, because a lot of these are also on that list, and then I'll keep watching what comes in the chat.
Great. Okay. Okay, let's see where this takes us. Some directors are hearing from staff that guidance may be too lax. I wonder if we can address how to lean on science and acknowledge the fear with staff as we discuss the guidance. So I think that's exactly what I need to hear from you, which is what is the messaging that you're hearing today, and how do we instill confidence in your team that this is based on a really strong body of understanding of the trajectory of this virus. So, this state has done so beautifully in this space, and our governor has a whole team of scientists who forecast, who get people vaccinated, and who look for that tipping point of herd immunity. So I really want to instill confidence in you as directors that, of course, people are going to have fear. My gosh, we have been through something, life-altering, but getting the right knowledge into the hands of people is one of the reasons we're doing this today, and we want to keep doing it in the months ahead. So let's figure out what the specific needs of your staff are. Many are still thinking small and very local in terms of field trips because they're hearing or having their own message of too complicated. Again, completely understandable from a psychological perspective. I imagine some programs are going to have sort of smaller radius this summer versus others that are going to say, I can do this. I'm going to take the kids to, I don't know, Canopy Lake. That one always comes to mind. I'm not sure why. Maybe you don't do that, but that seems to be a destination. So check in about that too. I mean, I don't think we should force people out of their comfort, but I also want to figure out if there's anything we as public health people can supply to make people feel more comfortable. So lots of questions about youth needing to face one direction when inside. Is it only when youth are eating, or at times, anytime they're inside? So we're still encouraging schools to leave those traffic patterns just because we're sort of settling into the lower case counts. But in the summer, you're not going to need to be marking directionality. That's gone. Eating is, has some inherent risk to it based on the way we breathe when we eat, and I prefer people to be distanced when they eat, and I think you can set them up sort of side by side. Outside is not a risk, as you know. It's inside eating that you will probably want kids to face forward when they're eating, but there's just not going to be that much pressure on this. It's sort of figure out your space, figure out if you want to do it or not, but there's no guidance about it. So one of the things that's come up a lot in the last week is if it doesn't say it in this new guidance, it means we're not speaking to it anymore, which I absolutely acknowledge is a strange space, but we weren't going to have a document that said you don't have to do all of this, right? That didn't make a lot of psychological sense, but I am recognizing that you need a lot of checking in with us in the school and childcare branch to say, so this is gone, and directionality is gone. Okay, what set of guidance should school-based programs follow this summer, and what are the differences? So the minute school is officially out from the educational, traditional side, you follow this guidance, childcare and out of school time. But I think the previous person's question about what those of you that are working in schools right now, I just need to understand a little bit better about like who's your boss, because if you're using the physical space, but someone else is your employer, you really can. And this came up all year. It's hard for kids to come out of the school rules and then they pop in at 3. I think I need specific examples from you on that one. What are the differences between the old and the new? I hope that was just clear in the slides. How do we balance between having more virus in the community, unvaccinated kids, and keep everyone safe? Yeah, so the absolute promise to all of you is that this is a fluid situation. If we start to see virus in either a local setting or across Vermont in a way that doesn't make sense to all the forecasters who have been watching the case count come down in the context of more vaccine, we will pause all of this. There's absolutely it's not a free-for-all. I mean, it's a very intentional approach. So, and, we have to get into this really important mindset that there's going to be minimal virus and that our kids are going to have some potential to get it because they're unvaccinated, but it's going to be mild disease and not that significant for the community. But that's a very big chasm for us to bridge in the next 3 months. And you have a lot of people with you. The pediatricians, the pediatric infectious disease people were all with you. Like, wait, what? So it's iterative. How do we remain informed and adapt as changes continue to take place and address the contradictions? For example, the health department's guidance for summer says to follow the guidance from Vermont Forward on mask and distancing, but Vermont Forward says to not follow universal guidance, but follow guidance specific to summer program. Exactly. So it feels circular, but Vermont Forward rules the day. And it's listed in your guidance, all the places where it should be followed. So I hear you on this, but we were very clear where you should be following Vermont Forward, and it's almost everywhere. What are programs doing if there's COVID positive person that has infectious period while attending who's performing contact tracing? Okay, we still want you to have someone in your program who is like a coordinator for COVID. And I think you all had that last summer. We are expecting so few cases, and we have tons of contact tracers now. We actually have contracted with a vendor who's going to pick it up and do it now, so health department people can go back to their important regular public health life. Contact tracing is going to happen all summer long. Your role in it will probably still be important. It is going to be important. You have to tell the contact tracer who was around that kid or that staff. So I don't know if you did a lot of this last summer. Our schools can tell you a lot about this. You have a role in line list creation, meaning, yeah, this is my program and this student was with these kids, and but it's not going to be that intense because we're going to have plenty of contact tracers that can help. But that also remains to be seen. We got to get started and see what it feels like. Because there are going to be more challenges in contact tracing because the kids are going to be moving about in a way that's not really as, easy to quantify. Like that, you had your pod, and these are the kids that were close contact. So there's going to be more gray zone here, but it's going to be worth it because it's such a rare event that we're going to have a case of COVID, and you're going to have so much more positive experiences for young people this summer. Okay, I'm not getting to transportation too quickly, Nicole, but I'm trying. I know that was so. Masks and distancing. Do youth need to face one direction? We talked about that. Do we need to wear masks outside? Yes, in the types of groups you have, until we get to that magic metric where we're no longer mandating masks. And at that point, it will drop away outside and in. We're really not doing an age group or setting difference with the masks at this point, with the exception that we've never required it for the littlest. And do youth and staff, vaccinated or unvaccinated, have to wear masks after July 4th? Again, I know why everybody puts the date in. The governor's team asked me not to say July 4th. After step 3, no masks. No masks. Do children and adults need to be distanced outdoors after July? No. We're going to see how this goes. We're going to have so little virus and so many people vaccinated. We have the highest rate of vaccination in the country today, Vermont. Again, easy to be first in such a great state. Do children need to be physically distanced during swimming? If you're going to be swimming before we hit that herd immunity metric, yes, but after that, no. So just swimming is just an activity within Vermont forward. Okay. Transportation guidelines, I think we addressed those in the slides. Field trips are safe. Many are still thinking small and very local. Oh, that's that same question again. We're also wondering about spacing on the bus, if we ought to have a bus monitor. So we're really encouraging windows open, no one sick on the bus, and if you have the room, let everyone have his own seat. But otherwise, do the best you can. So I don't know that you need a bus monitor, but your the youth you work with, and maybe bus monitors are a good idea anyway. I mean, that's a topic. But in terms of COVID or trying to keep kids apart, that's fading away as we head into summer.
And Brina,
My staff are up.
I was just there were a couple other questions that came in around field trips and transportation. So to reiterate, you can travel on a field trip out of state, right? There are at this point, no limitations.
That is correct. You can go anywhere you want in the United States. Do not go internationally unless you want to quarantine for now.
And here's one coming in about assigned seating on buses. Is that necessary, not necessary? And also one student per bus seat, or is all of that gone?
Okay, so best practice has always been assigned seating on a bus. Boy, have I learned a lot pre-COVID. And that's because that's transportation safety in the event of an accident. So I don't like to talk about that because it upsets me to think about a bus accident. But yes, to assigned seating, everyone needs to know who is on every seat. And we are not requiring spacing on a bus when the physical distancing goes away. So because the bus is physical, so this bus, by the way, already all through school, buses have done the best they can. They have not done the letter of the law with the 3 or the 6 feet. Maybe you already knew that. And that's allowable because buses are, it's harder to get everybody 6 feet apart when that used to be the recommendation. Now everybody's 3 feet apart as best they can. And then at the metric of step 3, you can stop thinking about the spacing on the bus, but you should know where every kid is because of transportation safety. Want me to keep going on this, or do you want to do chat? I think some of these are.
Go ahead.
I like This one, can we require staff be vaccinated? Boy, is that a hot topic. That's an employment law question, well beyond the scope of the health department. And you'll start to see some really interesting dialogues in this country about this. And you're watching private universities. Are you watching that list? Private colleges are, there's 5 a day that are saying there's not a student coming back here this fall without a vaccine. So can you require it? Again, I don't know your employment situation. So if you're private and you have a good lawyer, I'm sure you can. So I'm hopeful that people just get vaccinated. So there's a lot of questions about toys and supplies. It really is that you can share materials now, but please put your attention to general infectious disease principles, not fear of COVID, individual, everybody has to wipe, but we don't want kids wiping their nose, grabbing a marker, handing a marker to their pal, right? So we want to keep kids washing hands before play or hand sanitizing, washing after, but you can bring back all your tables and your sand and your water play and your shared toys. We've had a lot of questions about soft toys, and, you know, those aren't the best for infectious disease, but if you have a plan to wash puppets and dress up clothes and stuffed animals, go for it. But if you've enjoyed a time when kids were less sick, because they really were, this past year, pediatricians will tell you they had a low volume of visits for illness because people just did a better job. And then parents visit, you know, I would like to say on that front, in the traditional sense of a parent popping in to visit, you are a visitor. But if you're a parent volunteer with a role, I could see that being allowable in this, but I would imagine your programs are going to want to make that decision as a policy at the program level. Oh, okay. So I'll stop and do our chat. I do have a ton more questions in the next 4 slides from your childcare colleagues, but they may be too specific to that age group or setting. So what do you want to do, Nicole? Go back to the chat?
Yeah, let's do that. Here's a good one that came in. Is there a timeline for when under 16-year-olds will be able to be vaccinated? Do we have any news on that front?
Yeah, so you may have seen in the news, Pfizer has got good data about the safety and the response of the antibody from ages 12 to 15. And they have applied, or they're in the process of putting their paperwork together to apply for emergency use authorization, which will go quickly. So most of our planning is that we will be able to vaccinate 12 and up starting the end of May, maybe early June. And I actually mentioned this at the beginning of the call, and maybe some of you weren't on yet, just chatting with Holly and Nicole, that we're going to need a lot of engagement between people that work with young people, pediatricians, parents, to talk about that you know, the safety data, and that we're ready to vaccinate 12 and up. And I'm looking forward to that, because I think it needs youth voice to say, what do they need to know to feel good about that? And what are they hearing? You know, a lot of false rumor, our beloved social media, is putting forth things about menstrual periods and fertility challenges, with none of which has come out in the scientific space, but still being digested by young people. So I imagine there's going to be some hesitancy, and I'd like your help.
Yeah, I definitely think that there are folks in this group that can help with that. Dacia's asking a good question here about, is there a best practice when our kids that might be in one program and then they go to another organization's program and then maybe coming back? Any concerns of whether that's, you know, is that something they should be doing?
Yeah, we've stopped talking about that. I mean, that's one of those, the absence of the language means it's fine. We used to spend a lot of time talking about pods and cohorts, and that language is all now saying it's okay to mix. So I think I saw a question earlier too. So, and I think some of my team's on today. So the first big hurdle for us in this new world is prom. So the end of school gathering guidance says vaccinated people can go to prom honor system and they can dance, which is pretty, that's a face-to-face prolonged non-distance activity. So the health department team is waiting and wondering, what if someone with COVID is at the prom? Because you won't know where that student was, right? We've all been to prom. That will mean a lot of lessons learned about contact tracing and follow-up from a large group where one person may or may not have been in close contact with dozens and dozens of people. So we have to just watch that and learn and feel better that it doesn't happen, or that it's actually easier than we think. And that's your question too. So if you're going to mix a bunch of kids and stop distancing, oh, I got to switch headphones. The sign of a good webinar when your headphones die. If all of that is occurring, and then all of a sudden there's a case of COVID and 60 people have to quarantine, we're going to do quality improvement on that and say, well, that didn't work. You see? So we're going to just try to get back to normal. Hold on one sec.
Yeah. So what I hear you say.
Yeah, go ahead, Nicole.
I was just going to say, I think what I'm hearing Brina say is that this is what we know at this point. This is the plan at this point, and that we're all going to have to stay in really close contact with one another and keep communicating as it might change. Right?
Yeah, and then the world that's, not this summer, but past that, is that a case of COVID in an unvaccinated person or a young person won't, it'll be such a rare event that it won't trigger this huge response. As you know, we do not contact trace influenza or adenovirus, rhinovirus. Interesting. And again, I'm really with you on the off ramp. We had to go on the on ramp at 60 miles an hour together. And now I'm grateful we do have a few months to come off together.
Us too. It feels a little less fast and furious, right?
Hopefully. I mean, I just really want to know how it feels to everyone, but today's the start, right? Or for some, this may be your first day kind of grappling with it all. So just a real commitment from all of us that we'll do this as much as you need to.
So Brina, here's one. I understand that a child who has had COVID recently, a diagnosis more than 90 days ago, but not much more, may test positive without actually having a current infection. Is there guidance on how to handle when a child is identified as a close contact, quarantines, then test positive? Does everyone assume the positive is real?
Yeah, great question. Let me just take this through so I don't say it wrong. This is the kind of thing that my childcare and school team is so good at. Okay, so one, you are correct. We do not recommend testing within 90 days of a diagnosis. We do recommend it after that, but in a rare case, it could still be positive. So if someone is 90 days out from COVID and they're identified as a close contact, they get tested at day 7, and if it's positive, they have to stay in quarantine after 90 days. Prior to 90 days, we wouldn't recommend testing that person, and they would have to stay out the 14 days. I can take you through this better if we have an algorithm for this that is really intended for use between pediatricians and school nurses. So when you get into a complex thing that I need an algorithm for, I would hand this back to the pediatrician. because you shouldn't be deciding who gets tested when or what to do with a close contact. That's between the health department and in some cases the pediatric healthcare system for figuring out when, if at all, to test someone who's had COVID, who's also been exposed later. You know, it's a messy place because we don't know how long you're immune after natural infection. I hope that's helpful. I overstate the roles of pediatricians because you really need them. So I'm really not overstating. I'm just stating. Because each of these cases needs individual attention.
Here's one that came up a little bit earlier, Brina. Someone is asking if after July, after phase 3, I'm going to change my language around that too. After phase 3, masks are, we understand, are encouraged but not required. Can businesses require them? And does that then have an effect on a summer program that might be visiting that business? And can they require them?
Yeah, that's a very interesting question, and I don't know. I would imagine the governor's going to come in pretty strong on that. That you can't, as a Vermont business, you can't make up your own rules about this. But again, it's a legal question about. It's so interesting because again, we had the exact opposite problem 8-9 months ago, which was there was a mandate and businesses weren't complying. So how ironic if then a bunch of businesses decide they're going to make their own rules as we move away from a state government mandate. I don't know that. The way I talk about this is just from programmatic leadership and, where you're all sitting, I just follow I would stick with the guidance. But if what your staff and children and their families want to do, that it all just becomes personal choice, which I think is going to make for some really interesting conversations. And I think we have a lot more to learn about how this is going to roll out, and I can't predict that. Because right now we're just coming off of cases, right? We're only a couple of weeks from when we actually had a couple, 150, 200 cases. We're really in good shape now. I hope you're tracking it. We haven't been above 100 in 8 days or something. So where will we be in, June 25th in terms of that, wait, I still want a mask if I'm a business owner? I can't predict that. It's COVID time.
Yeah, that totally makes sense. Let's see. Jessica's asking, are there any doctors or researchers seeing signs that variants could impact kids under 12 more with no vaccine in sight for that age group, or are they still expecting those to be pretty mild cases?
Yeah, they're still seeing mild cases, Jessica. The biggest thing we've noticed about variants in children is the transmissibility, meaning, in the fall, if a kid got COVID, no one else got it around him. It was remarkable, or maybe one other person. And in the last month or two with high school kids and college kids getting a bunch of COVID, 2 or 3 people around them were getting it as well. So it's more transmissible, not causing more significant disease in the littlest. The vaccine for 6 months to age 12 is expected around December, January. So not too far behind on that one. Moderna's doing those studies. Pfizer's doing the 12 to 15. They're just all rapid fire here.
Yeah. Brina, there's a couple of questions that have just come in through chat. Can you talk one more time? If you could boil everything down, right? So what's the key piece around mask requirements as far as how we communicate that to program participants? And then also, go ahead.
Oh, go ahead. So the first thing to follow is that the way I would lead with all families and all of my staff would be follow the percentage of Vermonters eligible who are getting a vaccine, because there's going to be a place, and it's soon, where so many people are vaccinated that we're going to see maybe even single-digit cases. Like, we are ready for at that point, based on Vermont Forward, masks will be no longer required. So until then, it's all business as usual.
That makes sense.
Right? We're moving about with spacing. You know, this is why I got screwball this week. The CDC says, if you're vaccinated, you don't need your mask on outside. Vermont said, yeah, you do. Let's just keep looking at vaccinated percentages and follow our plan. But Saturday's May 1st. More people can be together, but we're still going to keep the mask and the distance. So that was a epidemiologic and scientific decision. Mask and distance until the threshold, and then both will fade. So that's the mask. What was the other question, Nicole? Or the spell it out clear?
I think you actually said it, because someone was asking about if your program starts in June before phase 3 is done, but I think you've answered it. Last question about pools. Multiple camps swimming at the same time in a pool facility. Any concerns about that, or we're just follow Vermont Forward? And
yeah, pools are just pools. I mean, you have to go back to where you were pre-COVID, which is, I'm sure there are safety rules about how many kids can be in a pool, but other than that, after this threshold, not saying July 4th, but probably July 4th, you can have large groups of people and you can move about outside in a pool.
yeah. So I know that we're just about at time here, and I know, Brina, you've got to head to some of our colleagues in the childcare world. So we really appreciate your time and really appreciate for all of you to join us and to keep engaged in this conversation with us. And we will keep updating you. We'll keep holding more field forums if we need to, offering more technical assistance, more support. And I know our colleagues at the Department of Health and with the pediatricians are right there lockstep with us. So with that, we will send out the recording of this call, but we hope that the rest of you, or that you have a great rest of your day. Take care, everybody.
Thanks, everyone. Your feedback on this is the crux of the whole thing. You know, I need your questions. I need your clarification questions. I need your comments, because we have to do this together, because it's a major shift, and we're doing it with science, but we have to do it together. I'm so grateful for the time. Let's do it again soon.
Thanks, Brina. All right, bye, everybody. Brian, did you get everybody? I just want to make sure you're all set.